Hello, and thank you for inviting me to speak at your town hall meeting today. My name is Greg Sheridan, and I'm an environmental health specialist at the Arkansas Department of Environmental Quality. This presentation is geared toward you, the residents of the Crescent Ridge community. I'm here to talk with you about the debate on water fluoridation and the impact that fluoridation may have on your health. There are a lot of small water systems, like yours, who have entertained the question of whether to begin buying water from larger systems because of potential benefits they can afford. We are going to discuss the fluoridation debate, and hopefully you will have enough information to make an informed decision about whether or not fluoridated water is right for your township. This is an outline of my presentation today. I'll begin with a brief history of water fluoridation and mention the highlights. I will then discuss arguments that have been presented in support of water fluoridation, but also arguments against it. And finally, I will present my viewpoint on this subject, and I will encourage you to evaluate the evidence for yourself in deciding whether you should purchase treated water from the larger neighboring municipality. So what exactly is water fluoridation? Simply put, it means we are adding a known amount of fluoride to our drinking water to prevent dental caries. I have an undergraduate degree in chemistry, and I love talking about the periodic table. As you can see, fluorine has an atomic symbol F. So let me introduce you to fluoride and some of its properties. Fluoride is the ionic form of the element fluorine. It is the 13th most abundant element in the Earth's crust. Fluoride is negatively charged, and it combines with positive ions such as calcium fluoride and sodium fluoride. Such fluorides are released into the environment naturally in both water and air. Fluoride compounds also are produced by some industrial processes that use a mixture of calcium phosphate compounds. In humans, fluoride is mainly associated with calcified tissues, such as bones and teeth, because of its high affinity for calcium. Let's talk about some history. Picture it. It's 1908. Dr. Frederick S. McKay began to investigate why people in some Colorado communities had tooth discoloration or mottled enamel, but their teeth were still resistant to decay. He also investigated cases in Oakley, Idaho, where a communal pipeline was built into a warm spring. Also, Dr. F. L. Robertson found that people drinking water from a well in Bauxite, Arkansas also presented with mottled enamel. It wasn't until the 1930s that a photospectrographic test was conducted on the water from this bauxite well. Results showed a lot of naturally occurring fluoride too. Tests with the Colorado water also gave the same result. McKay then deliberated on a way to harness fluoride at a level that would inhibit dental caries as well as mottled enamel. This led to a study of 32 communities with naturally fluoridated water, and they came to a consensus that setting a standard of 1 part per million would achieve this goal. Furthermore, in 1945, Grand Rapids, Michigan became the first city in the world to adjust its water fluoride concentration to the new fluoride standard, with Muskegon, Michigan being used as a control group. After 6 years, children in Grand Rapids showed 50 to 66% less decay than in Muskegon. Soon, other cities followed suit with the fluoride standard like Newburgh, New York, Brantford, Ontario, Evanston, Illinois, and just to name a few. Following this, in 1950, the U.S. Public Health Service recommended community water fluoridation as a public health measure, with the American Dental Association following 6 months later. By the early 1980s, epidemiological evidence indicated that the prevalence of dental caries was declining in the United States, with 3 national surveys between 1971 to 1987 showing that children demonstrated a continued decrease in dental caries prevalence. This brings us to today, where this is a map of the world showing the percentage of people in many countries that have access to fluoridated water. It's from 2012, but is a fairly good representation. As you can see, the United States, Brazil, Colombia, and Australia have the highest percentage of the population receiving fluoridated water, but much of the African, Asian, and European countries lack data to this effect. Fluoride in water is regulated by various governing bodies like the Environmental Protection Agency, where the enforceable standard is 4 parts per million or 4 milligrams per liter of water. This limit is set so that exposure to too much fluoride is avoided and that the public is protected against adverse health effects with some margin of safety. There is also a secondary contaminant level of 2 milligrams per liter of water, which is non-enforceable and is a guideline for regulations that deal with cosmetic effects like tooth discoloration and the taste, color, and odor of the water. Now, the Department of Health and Human Services, though, has also set a recommended level of 0.7 milligrams per liter of water, which is considered the optimal fluoride level to prevent tooth decay. This is a schematic from the Department of Health and Human Services that allows us to visualize in everyday terms just how little 0.7 milligrams per liter water actually is. It's similar to 1 inch in 23 miles, 1 minute in 1,000 days, or 1 cent in $14,000. And if you look a little closer at the slide, you'll see a bit of promotion of fluoridation that before fluoridation, children had 3 times as many cavities. And the American Dental Association is a good resource and supporter of water fluoridation. This latter point allows us to segue into the arguments that the American Dental Association and other agencies have put forward in support of water fluoridation. Firstly, according to the Centers for Disease Control and Prevention, water fluoridation was one of the top 10 public health achievements of the 20th century, and this notion is used quite a bit in the literature surrounding support for water fluoridation. Secondly, fluoride has been scientifically proven to strengthen teeth and prevent dental caries. Many studies have been conducted and mainly involve children since their tooth enamel is more vulnerable to decay. I will give you a couple of examples. There have been many studies conducted since the 1930s that revealed a lower incidence of caries in the children that drank naturally occurring fluoride compared with those who did not. Specifically, one study showed that children consuming fluoridated water from birth had 50 to 63% less dental caries than those who did not. Fluoride is also recognized for its ability to provide teeth with a stronger resistance to acids that lead to decay and demineralization. Thirdly, as we alluded to earlier, many of the recognized authorities on the subject of tooth decay, like the ADA, the WHO, the CDC, the EPA, as well as others like the American Academy of Pediatrics, American Medical Association, American Public Health Association, American Council of Science and Health, and the American Society of Clinical Nutrition. There are also agencies in Great Britain, Canada, and many other countries that support fluoridation. This is just a small list. A more comprehensive list can be found at the dentalwatch.org website. Fourthly, remember Paracelsus, who is known as the father of toxicology. He said that the dose makes the poison, and it has been argued that the minuscule amounts of fluoride added to the drinking water is at a very safe level. The primary governing body, the EPA, has proposed a reference dose of 0.08 milligrams per kilogram per day for protection against pitting of the tooth enamel and concluded that this value is also protective against fractures and skeletal effects in adults. The reference dose is the estimate of the daily exposure that is likely to be without harmful effects during a lifetime. Also, there is a lack of scientific evidence linking community water fluoridation with an increased risk of cancer, Down syndrome, heart disease, osteoporosis and bone fractures, immune disorders, low intelligence, renal disorders, or allergic reactions. Related to this is the argument that fluoridation is not only safe, but effective. There have been many systematic reviews of the literature that shows that there's a lot of evidence from many different countries that show a correlation between water fluoridation and reduced incidence of tooth decay. Additionally, by preventing tooth decay, community water fluoridation has been shown to save money both for families and for the healthcare system, and evidence continues to indicate that the economic benefit of community water fluoridation exceeds the cost. Lastly, for the sake of this discussion, but certainly not least, is the notion that fluoridation is a way to help reduce population disparities by leveling the playing field, as water is required for life, and water fluoridation has been identified as the most cost-effective method of delivering fluoride to all members of the community, regardless of age, social status, or income level. This graph is put in to give a further idea of how widespread water fluoridation is. We can see a clear trend in the increasing U.S. population from 1940 to 2014, indicated by the red line, and both the number of community water fluoridation systems, the blue line, and the number of these systems that employ fluoridation, the green line. This is versus the yellow line that shows relatively little to no change in the population receiving naturally occurring fluoride in their water. Now that we have discussed the arguments supporting water fluoridation, we also need to pay attention to the existence of a group that opposes this practice. The main thing to note here is that these movements are not necessarily scientifically motivated. Firstly, Many of these groups refer to fluoride as a medication that is freely added to water without individuals' prior consent to be quote unquote treated. In contrast to claims by the CDC and other agencies, there are also arguments that long-term fluoride ingestion can and does lead to health effects. So contrary to the dose makes the poison, they argue that skeletal and dental fluorosis can occur, which is a result of the deposition of fluoride on teeth and bones, since typically only some fluoride is excreted. Arguments have been forwarded for thyroid and neurotoxicity, but there haven't been follow-up studies to substantiate initial claims. Additionally, the dose of fluoride would have to be many orders of magnitude higher than what is seen currently in order to have the ill effects that are being put forth. It is also argued that, contrary to the reducing of population disparities, fluoridation does not take into account vulnerable populations that require individualized therapy and not mass medication. Opponents claim that susceptible populations with low body weights, such as infants and children, and individuals who consume increased amounts of water, such as athletes and physically active individuals, as well as those with diabetes or kidney problems, can be affected by fluoride. Anti-fluoridation efforts have also blamed the scientific studies for being flawed in their methodologies, but these have been more geared towards the early trials between 1945 and 1955 in North America that helped to launch the fluoridation. The study's choice of target and control groups are especially criticized. Also, it has been stated that there is no need to swallow fluoride to protect teeth. Since the reported benefit of fluoride is topical, but the risks are argued to be systemic, opponents claim that delivering fluoride directly to the tooth in the form of toothpaste is safer. They also say that swallowing fluoride is unnecessary and there is no good reason to make people ingest it through the water they're drinking. This graph shows the number of decayed, missing, or filled teeth plotted against the year from 1970 to 2010 for a number of countries that fluoridate and do not fluoridate water. Opponents claim that since there is a downward trend in both categories, then fluoridation is not essential and there may be other variables involved in leading to decreased incidence of dental caries. But again, this is only a handful of countries, and more studies from other countries would have to be done to strengthen this argument. So as you can see, there's quite a movement out there with lots of reasons why fluoride should not be added to our drinking water. So now we've presented both sides of the argument. I want to spend a second sharing with you why I'm in support of community water fluoridation. This is summarized in the major points in this figure. Fluoride reduces and prevents dental decay. It's been proven. It was recognized by the CDC as one of the top 10 greatest public health achievements ever. It provides cost savings and it's non-discriminatory, meaning it benefits all people. Also, could I have a show of hands of those of you in the audience who drink tea on a regular basis? Ah, I see there's several. Thank you. Tea is a widely accepted beverage and millions of Americans do not think twice to consume it. But did you know that tea has natural fluoride in it comparable to the amounts we put into our drinking water? Most orange and black pekoe teas have between 3 to 4 parts per million fluoride when you make a tea solution, but of course that all depends on how strong one likes their tea. I think that having fluoride in the drinking water is sort of a non-issue for Americans that are regular tea drinkers, but that's just my opinion. I hope I haven't discouraged anyone from drinking tea based upon my comments today. So in consideration of the evidence provided both in support of and opposing water fluoridation, I think it's important to ask the following questions and to see if they have been answered. Does water fluoridation work? Is it safe? What is the risk-benefit balance? Is it acceptable to the Crescent Ridge community as the target population? I hope I was able to answer these questions favorably today, and you are more equipped now to make a decision on purchasing fluoridated water from the larger municipal source. In also considering the evidence before you, we also need to consider these points. We need to continue researching the health effects of fluoride consumption so that we can understand and appreciate the benefits that fluoridation can afford. We also need to research the implementation of affordable techniques to reduce levels of naturally occurring fluoride in water systems to the levels recommended by the regulatory agencies so we can avoid overexposure to fluoride and any consequences from that. We also need to better understand the public perception of dental fluorosis and whether or not arguments for or against fluoridation based on this are scientifically sound. In summary, I introduce you to the concept of fluoridation and the fact that there's a real debate out there on whether or not fluoridation is a public health benefit. Supporting arguments for fluoridation included that it is safe and effective and scientifically proven to reduce dental caries. It is also endorsed by numerous reputable organizations. Arguments against fluoridation are that it's a form of mass medication and can lead to adverse health effects. It is perceived as a poison that should not be purposefully ingested. But note well that there's a lack of scientific evidence to support these claims. Personally, I am all about community water fluoridation, and I am so glad to have had this opportunity to talk with you about it today. And here are some sources from which I assembled the information for this presentation today. And here are some additional references as well. I will leave you with my contact information for if you have any questions after today's presentation. This information will also be found on my business cards, which I've left at the back of the room for your convenience. I've left a sign-up sheet at the back of the room as well for those of you who would like a copy of this presentation emailed to you. Again, I thank you very much for your invitation to present to you the debate on water fluoridation, and I hope it has been very useful in your decision on whether or not to purchase fluoridated water from your neighboring municipality.